Hi, welcome. This presentation, we're going to talk about risk factors, precautions, evaluations, and other useful information for our NCLEX RN exam. You can download the template under the descriptions. This presentation is for the purpose of private study and research. I used Kaplan, Your World, Registered Nurse RN, NCSBN, and other useful resources for these presentations. Okay, let's start. This one on the left side, far left, I used for disease or treatments. And then the risk column, nursing diagnosis, priority, equipment at bedside, because they're gonna all pop up. Those are the type of questions that NCLEX like to ask. For example, take stroke as example. The NCLEX say patients are at risk, most at risk for which conditions? Then aspiration will be one of them. Then you tick this one. Then a question say patient had a stroke. What's your priority? And then management, oscillate lungs. What else can we do? Check vital signs, etc., etc. But then oscillate lung is the priority with the stroke because to do with breathing. Patients at risk of aspirations as well. So that's how you see it. And then a question could be about equipment at bedside for stroke. So what I leave them in blank because I haven't encountered them. But when you do a sample question, rather than copy all questions down, you can just write down here. It's much easier, and then you got the answer you want. Next time when you see the exact quite similar question, you know what the answer is. Precautions. I like to include a precaution because they give you a conditions and then say what precaution should you apply. For seizures, if patient has epilepsy, hyponatremia, hypocalcemia, hypomagnesia, then you probably want to put them in seizure precautions. Again, here I also include equipment, ambule bag, oxygen and suction equipment. Now, bleeding, for example, here the conditions: cirrhosis, kidney biopsy, thrombocytopenia, hemophilia, placental previa, heparin, septic shock, DIC, and yes to the following things you can do to prevent, to reduce the risk of bleeding. And here's the things you want to avoid. The exam could ask you, say, patient had a hemophilia and there's a prescribed IM medication that's due now. So what would you do next? So the answer we should stop it because there are risk of bleeding. So we need to notify the doctor. Wear medical bracelets. This often like to appear in the select or the apply questions. For example, patients had Addison's, and then one of the questions is wear the bracelets. Is it right or is it wrong? Depending on the question, of course, but the answer is Addison's. For Addison's patient, you should wear the medical bracelets. Continue on. Take this one as example. Increase intraocular pressures. We want to avoid it in the situation of retinal detachment, cataract surgery, glaucoma, ocular hypertension. For example, question could be patient had a cataract surgery and then feeling bloated or feeling not able to pass stool. Then what we want to avoid is avoid then have to straining the stool, the bowel motion, because it will increase the intraocular pressures, and that means. So we need to notify doctor, prescribe medications to help the bowel motions. And here's the following things you can do. So add notes to it as you summarize or as you encounter the sample questions. For this one, it's about the treatments and the therapeutic effect. Here's the treatment and does it work? The positive effectiveness should be a positive sign and symptoms. For example, if patients malnutrition, then we give the, for example, in NG feeding, then we want to look at albumin, make sure that they're within normal range. Sometimes, so the question could be patient's malnutrition and then on NG feeding. If you want to check the effectiveness, here are the 4 things. Which one do you check? So they got, like, for example, vital signs, fluid status, albumin, blood culture. Then the answer will be albumin. For furosemide, you want to check blood pressure because it will tell you it acts on blood pressure quite quickly in comparison to urine output weight declines. I mean, you can still check urine output weight declines. That would be in select or that apply question. If patient has furosemide, what can you do? You say, oh, I will check blood pressure, check the urine output, weight the patients. That's fine. But when it comes to you can only pick one. Check blood pressure will be the priority. Nitrate. Nitrates, the effect of nitrate is decrease blood pressure and increase heart rate. So you want the effectiveness you want to see is what its really job's doing. Finally, assess the fluid balance of an elderly client. We want to use input and output as a measurement. If input and output balance out, that means they have sufficient fluid. Now, we cannot check blood pressure because there's age-related hypertension, so it's inaccurate. Then we cannot check the skin because the elasticity it's decreased due to the aging process. And then says we could not do that because elderly tend to have decreased sensation. So that's inaccurate as well. Now, risk factors. Here are the condition and here are the risk factor. So you don't have to remember all the risk factor. Remember the one that you know you're gonna trip over and make mistake on. Just add to that part. For here, I tend to get confused. Which one's the answer? Which one's not? So take this one as an example. Not the answer, wrong facts. These are not the answer for COPD. These are not the risk for COPD. Well, in fact, these one are tobacco, smoke, air population, occupational exposure to chemical dust. That's the risk factor for COPD, not alcohol, poor nutrition, overweight, exposure to individual with respiratory infection. So I just do it like this. Another example is confusions. Age is not a risk factor for confusions. Here's the prevention or management. For C. diff, norovirus, rotavirus, we do not use alcohol wipes. It does not help with destroying the organisms. We need to use soap and water to wash our hand. Acronym. This is how I do my acronym. That way I can easy to remember it. But you can do whatever makes easy and sense to you. And that's it from this presentation. If you got any question or you got any comment, leave me a comment at the notes, or you can just shoot me an email on this one. Thank you.